India is likely to witness third wave of coronavirus by starting September, researchers at IIT Hyderabad and Kanpur have predicted. They are the same experts who had accurately predicted the second wave of the COVID-19 pandemic, where others says there will be no such second wave. According to them, the third wave is already upon us and may reach its peak in October 2021. The researchers have predicted that October will see the peak of third wave when daily case could rise up to 6 lakhs cases per day. Again, a committee of experts constituted under the National Institute of Disaster Management, that is NIDM, has warned of an imminent third wave of COVID that could peak around October and suggested better medical preparedness for children who might be more at risk. A report has been submitted to the Prime Minister's office, that is PMO, which states 1. There is third wave that is imminent. 2. The pediatric facilities need to be prepared at the soonest. The Ministry of Health Government of India has cautioned to all states ahead of the festive season and asked them to take necessary action to avoid public gatherings in order to check the expected third wave of COVID-19. Don't skip this video, watch the video full, it might save life of yours or your loved ones. The Delta variant of coronavirus has already spread to 11 countries so far, including India, raising fears that it could drive the next wave of infection across the world. The progression of illness seems to be prevented by vaccination. Now, VK Pal, head of the COVID task force Niti Aayog, has also said that India may see up to 6 lakh cases a day in the coming months and a greater risk of the pediatric population. Scientific logic dictates that a new wave of any contagious or a virus like SARS-CoV-2 could emerge 2 to 3 months, that is 8 weeks after the end of the past wave, while the second wave peaked around the end of May. September and October could be the months to watch out for, especially considering the fact that it also the festive season across the country and a time which usually records high footfall and crowds. Latest study reveals that the R number, or the reproduction rate of the virus, rising from a steady 0.9 to 1.1, where a number above 1 is said to be alarming because when R is greater than 1, it suggests high ability to spread and transmit of the virus, which could be far more lethal than the first or the second wave put together. First identified in India in October 2020, B.1.617.2, also known as the Delta variant, is considered responsible for the second major outbreak wave in the country. In third wave, it's expected Delta, Delta Plus, or any other new mutation of the virus could strike us in a more deadlier way. A recent study from the Center for Disease Control and Prevention showed the viral load of the Delta or Delta Plus variant was about 1,000 times higher than the initial strain of the coronavirus. For more details on Delta and Delta Plus variant, you can watch this video, which is already given in I button. A panel set up by the central government in its latest report has warned that in the expected third wave of COVID-19, a better medical preparedness for children or pediatric age group is needed, as they remain a cause of concern since they are not still vaccinated. The Lancet COVID-19 Commission India Task Force report also points that though children have milder disease and low mortality rate as compared to adults, those with underlying comorbidities might be at higher risk. According to a recent study done by professors and alumni from Pandit Deen Dayal Energy University (PDEU) in collaboration with Nirma University, the vaccination rate of India is currently at 3.2%. It stated that if the vaccination rate does not improve, India can witness 6 lakh cases per day in the next third wave. For more details on symptoms, treatment and prevention of COVID-19 among children, you can watch this video which is already given in the I button. Prediction of COVID third wave in India using time series forecasting with deep learning model forecast that this ramped up vaccination strategy can contradict COVID infection during the third wave peak by 85%. Hence, vaccination is the only way out of this pandemic. Prevention. For preventing COVID-19 expected third wave, we have to follow the following points. Number 1. Follow COVID appropriate behavior, which includes wearing your mask, maintaining social distance and avoiding crowded areas. Number 2. Non-essential travel should be avoided. Number 3. Children are the most vulnerable in this upcoming predicted third wave, so parents should closely monitor their children every time. Number 4. Don't remove mask while in public places. Number 5. Do proper hand wash or use hand rub before touching your children. Number 6. Take vaccination as early as possible. So that's all for today. Like this video, share this information with your friends and family immediately, and we all can prevent the expected third wave by sharing the scientific information. Subscribe the channel for latest scientific health related updates. Take care.